So I have the privilege of being first today, and I'm just going to just kind of set the stage for the rest of the day and talk about what we do in our college and the College of Nursing Health Innovation. And I'll tell you right now, a little bit early, that we're not going to have formal bios read for each speaker. We're going to go through that. That'll speed up the conference a little bit. Each speaker is only talking for about 18 minutes. So if you didn't get a program, you can grab one at the front desk, and it has a bio of each speaker, so we don't have to go through that. And the second thing is we're going to ask you to hold the questions till the end, and after they're done, the next speaker is going to come up, and then 4 speakers are going to come up at once, and you can ask questions at that point in time. All right, so let's talk about innovation in a wholesome way. ASU has a culture of innovation. If you haven't seen it on all the billboards, we are the #1 innovation institution in the United States for the 4th year in a row. That just got announced probably about 2 months ago. For the 4th time in a row, we were recognized by U.S. News and World Report as the #1 innovation school. And I believe that's really much part of the design of the school. So this is President Crow a few years ago doing his State of the University address, where he actually talked about ASU as a culture of innovation. There's of course, the SkySong campus that some of you are familiar with in Tempe. The point is that innovation can be taught, and that's what we do here in our college. As Dr. Karshmer was saying, we have innovation embedded within our college. So if you look here, we have the Bachelors of Science in Health Innovation and Entrepreneurship. We have the Masters in Health Innovation, Healthcare Innovation Program, the MHI program, the Advanced Nurse Practitioner Program and Innovation Leadership, and the Nursing Healthcare and Innovation PhD program. In addition to that, we have an Executive Fellowship in Health Innovation Leadership program that I lead, and we have immersion experiences. It's a 1-year program that we take folks in that program in different immersions throughout the country. We go to Boston, we go to San Francisco, we go to MIT, we go to HEALab. So these are just all opportunities that we have to teach and embed innovation within our students. Just some unrelated random facts of healthcare that we all have probably seen in other places is 28.5 million people still don't have health insurance in the United States. 10,000 are retiring, 10,000 baby boomers are retiring daily. Aging is going to be a major issue for entrepreneurship and innovation in the healthcare space in the next several decades. The shortage of doctors, and of course, as we know, nurses as well, and the latest results show that almost 40% of Americans are now obese. The old statistic was a third. It's gone up to like 39.8%. And about almost 1 in 10 Americans have diabetes. So you can look at these as problems. You can also look at them as opportunities. And so when I look at innovation and I look at entrepreneurship in the healthcare space, I look at it from the mindset of an entrepreneur and an innovator and saying, it's pretty easy if you're looking for problems to solve in the world to find health as part of that. Because whether you're an engineering major or a business major or a Cronkite School of Journalism major and you're looking for problems in the world to solve, healthcare is often at the forefront. So what we do at ASU, and including in our college, is we look at the design of the university, and if you look at the charter of the university, there's 8 pillars, and one of them is to value entrepreneurship. And that is literally to use the skill sets of entrepreneurship and intrapreneurship to solve problems. And if we could teach our students at the freshman level, at the master's level, at the PhD level to solve problems, then we're creating leaders who aren't just going to be practitioners in the field, but actually be problem solvers or innovation leaders. Some of the things that the university offers, we have the Venture Devils program where students can actually get funding for their ideas. We have, starting this April, we're launching a Mayo MedTech Accelerator with Arizona State University. It's the ASU Mayo MedTech Accelerator, which will be at the Mayo campus and eventually on the ASU space in the Mayo campus, and that launches in April. Because of that, we have technology-based ASU startups in the healthcare space. These are just 3, but there's dozens and dozens. At least 2 will be here today and are going to be out in the lobby for you to explore that have been ASU startups. But EpiFinder looks at using artificial intelligence to diagnose epilepsy. CoreWave is a student, a bachelor student, who developed a headpiece to diagnose or to predict the onset of an epileptic seizure. And recently, he's actually doing it with pets. So he just sold his first one and flew it out to Chicago. He flew himself out to Chicago to deliver it. So it's actually being used in pets right now to diagnose or to predict a seizure before it happens. And then Neolight, which is a portable incubator or light that uses for bilirubin in infants that you can use with LED lights. These are just 3 of dozens and dozens of healthcare startups that have come out of Arizona State University. So we launched on this campus is the HEALab, the Health Entrepreneur Accelerator Lab. We launched it last year. Several of our HEALab advisory board members are here today. It's a stone's throw away from here. You could walk to it pretty easily. I'd be glad to show it to you at the conference if you're interested in seeing it. But the idea is that we're going to help students, faculty, staff, even community members solve problems using the skill sets of entrepreneurship in the healthcare space. So we don't really care where they come from, but if you have an idea and you want to launch an idea, we want to help you do that. And hopefully we can also help you find some funding. And we've had some great success at helping students find funding, either through like the Venture Devils program here at Arizona State University's internal funding mechanisms, or sometimes externally as well. One of our Masters in Healthcare Innovation students just received $50,000 to launch her idea in grant money. So I want to set the stage for what the rest of today looks like. If you look, this is the program. We're going to start with some speakers in the morning that I'm not going to introduce. They're going to be here for you to read their bios, and they're going to come up each one at a time, do their presentation, and then afterwards, we're going to get the chance to ask them questions all at the same time. We are going to take a lunch from 12 to 1, a lunch break. There's food in the back that you're going to have the privilege of eating, but there's also going to be all the tech demos in the hallways here from everyone, all the companies who came to represent and to showcase their materials. Some of us have been here since 4:30 this morning because the news wanted to come and broadcast that, and if you were watching Channel 15 this morning, you probably saw some of those already. But they're going to be out here, so we want you to spend that time eating, of course, networking, of course, but also walking through the booths and seeing what they brought. And you'll have a second chance to do that this afternoon. We're going to have our second set of speakers doing 18-minute talks, and they're going to have time to answer questions at the end in a group. And then finally, we really hope you stay. Oh, what's this one? I can't read. It's 2:30 to 3. Oh, that's the second tech spot. So we have two opportunities to do demos. One is from 12 to 1. The second time is from 12:30 to 3, or 2:30 to 3. So for that last half hour, we'd like you to do that one more time in case you didn't get to any of the booths. There's a lot of folks here, and there's more coming. So if you don't get a chance to see one of the booths, you'll get a second chance at 2:30. And then finally, we really hope that you stay from 3 to 4. And right outside there, on the north side of this building, is our Health Innovation Exhibition. And that's part of this event. It's in collaboration with this event, and we really hope that you stay for that. So these were over 550 students they've been working in groups of 4, 3 or 4 groups typically, all semester on an idea. These are freshmen. These are 18, 19-year-old students. And we've encouraged them to be very, very, very innovative, meaning go crazy. And you're going to see some crazy ideas. Some that you're going to shake your head and say, there's no way it's going to work. And I can tell you this, there's a lot of things that we're doing today that I never thought were going to work. So when some of these ideas are so crazy they actually might work. But I want you to stay and come and see them. And we're going to give away those 3 checks over there on the right-hand side. There's a check for 500, I can't even read, 3,250, or sorry, 250, 500, and $1,000, my fault. And that's the idea of those checks is not to give them cash, but to actually help them launch their idea, to bring them into the HEALab and use those as a starting seed money to get their ideas launched and get them into the Venture Devils program and potentially get launched and get more money and to get their idea funded. And by the way, that's a picture of last year's winner with some of our judges last year. These are some of our planning committee group for today's conference, so I just want to publicly thank those folks. I also want to publicly recognize the food that's going to be served today. One of the groups that we run out of the Health Entrepreneur Accelerator Lab is a program called PrEP, where we target women, people of color, and folks that are coming from disadvantaged communities that are trying to start launch a mobile food business, whether it's a catering business or a food truck. We're on our 5th cohort of that. So we've been doing it for the last 2 years, and this is our third year. And when we can, we always try to hire prepped graduates. And so today, you're going to be served lunch by Santee's Catering, and they're in the back. Their food's going to be coming in the back. So these guys I'm sorry, the 319 Hidden Kitchen is going to be catering our Health Innovation Exhibition. So there's going to be some snacks for you and hot chocolate after this. And then finally, Pura Vida is involved because we're giving, they're a coffee, they do coffee, and we're going to give those as gifts to some of our speakers. So I wanted to recognize them. And finally, I want to recognize our team because you can't even imagine the planning that goes into something like this. So these are our folks that kind of helped put this conference on today. So if you don't mind, just give them a round of applause.